Thank you so much for inviting me to speak and to have a chance to talk about this topic that's become near to my heart. And as a child psychiatrist and an addiction psychiatrist, and I work in the adolescent substance abuse program at Denver Health, where 95% of our referrals are for marijuana, and nationwide it's about 2/3 of adolescents are referred to substance treatment for marijuana. So if you work in this field, then marijuana becomes an important issue to you. And what I wanted to do today is to first share some bad news. Basically, I want to go through my top 10 reasons why I think that marijuana should not be made legal for recreational use, and why I would encourage CCAPs and other medical organizations to oppose legalizing marijuana. And but I want to say a caveat with that most of my life I've been a card-carrying member of the Libertarian Party, and I thought that legalizing drugs was just a wonderful thing, and legalizing marijuana would be so wonderful. And until I got wrapped up in this whole thing in the last couple years, I believed that. But what I've seen recently has really made me change my mind, and I still have a lot of live and let live to me, so if people disagree with me, I encourage healthy discussion and debate about that. In terms of drug prevention science, this is just a little schematic on that. Adolescent substance use is thought to be made up of three main ingredients. So how available a substance is, how harmful it's perceived to be, and then the social norms around it in terms of, is it acceptable for me to use it? Do I approve of my friends who use it? Do my friends approve of me if I use it? That kind of thing. And so those are three main ingredients, and you can see how these could, at least theoretically, be very influenced by what's happening in the state and by outright legalization of marijuana in the state, making it much more available, decreasing the harmfulness. It's medicine, right? And then the social norms, if you know people with medical marijuana licenses, then that could really have an impact, at least hypothetically, on your norms around it. And so that's the brief background, so I'm just going to go through my David Letterman top 10 here. So my top 10 reasons why I think legalizing marijuana is a bad idea for our adolescents. And the first one is that since we've had our de facto legalization of marijuana in Colorado, adolescent marijuana use seems to be increasing. So I had to put the word seems in there because the Monitoring the Future study, the National Survey on Drug Use and Health, which are the nationwide studies that are done every year, the state level data for those studies won't be available for years to come, probably about 3 years or so. And by then we will have already made very important policy decisions around this. So we have to rely on the data that we do have, and I'm going to present what I am aware of. So there's the Adams County Youth Initiative, which tracks substance use and a lot of other important variables in Adams County. So that's in Denver metro area. It's Commerce City, just north of Denver. And this is change in teen marijuana use since the Ogden memo here, so from 2009 to 2010. And we have the percent of adolescents in high school in Adams County reporting past month marijuana use. And in 2008 it was 19%, and in 2009 it went up to 22%. And so when I did my algebra on this, that's about a 16% increase in 1 year. And so that's a pretty big increase in just 1 year. And then there's school expulsions for drug use, and this is reported by the Colorado Department of Education every year. And so we just have the number of school expulsions for drug use. And now this is drugs, any drug in general. So, but it's widely known that the vast majority of this is for marijuana. And then here's the different school year, 01, 02, all the way to 09, 010. And you see in this year here, 08, 09 to 09, 010, it jumped from 534 to 753, which is a 40% increase in just 1 year. Right during, again, when that big explosion in medical marijuana use occurred in Colorado. Then these are some data that we collected at Denver Health. These are 80 teens in substance treatment at Denver Health. And we surveyed them, do you know anyone with a medical marijuana license? And have you ever obtained marijuana from someone with a medical marijuana license? And so 81% of the teens in my clinic knew someone with a medical marijuana license. And then about half reported ever getting marijuana from somebody with a medical marijuana license. And I think, well, one, this represents, at least a significant number are getting their marijuana from someone with a medical marijuana license. But I worded this question, in retrospect, I wouldn't have worded it so directly. Other researchers in the area who have worded it, have you ever used someone else's medical marijuana, are getting much higher numbers, around 80% or so, saying yes to that. Marijuana is physically and psychologically addictive, especially for adolescents. And I'm going to go into why it's such a big deal for adolescents especially. So 9% of all people, anybody who tries marijuana, develops marijuana abuse or dependence. But if you try marijuana before the age of 18, 17% of those develop marijuana abuse or dependence. So there's something that makes adolescents especially vulnerable to this. And we're going to get into that briefly in a second. And then 1.7% of all Americans have marijuana abuse or dependence. With respect to adolescents, about 40%, so marijuana accounts for 20% approximately of all substance treatment admissions, which is number 2 behind alcohol, pretty consistently every year. And of all those marijuana treatment admissions, about 40% are teenagers. And marijuana accounts for, like I said, 2/3 of adolescent substance treatment admissions across the country. So there's really something about adolescents that are especially vulnerable to becoming addicted to marijuana. Here's another story of how does adolescent marijuana use affect cognition. So again, we're not going to have an ethical placebo-controlled study in humans, but the data that we do have compared adults who reported starting their marijuana use before the age of 17 compared to those who reported starting their marijuana use after the age of 17. And these are some of their findings here. Those using before the age of 17 having decreased verbal intelligence, decreased verbal fluency, decreased word recall in 30 minutes, so the number of words you can remember after 30 minutes, decreased visual scanning ability, which they were given a screen to look at, and they had to identify quickly a certain object on the screen, and they had decreased ability to do that. They had decreased reaction time with that. Then some interesting neuroimaging studies showing that those with early onset marijuana use having decreased whole brain volume, decreased cortical gray matter, and increased cerebral blood flow. So some biological differences. Their exact meaning we don't exactly know. So again, we have to rely on animal studies with this here. And so these are the results, kind of a compilation of, again, mice, rats. In this case, it was mice exposed to marijuana or THC as adolescents, like about day 20 of their life, and then followed into adulthood. And the adult rats, or adult mice, who were exposed showed decreased motivation. They showed increased anxiety. So in like an open field test, they were more anxious. Decreased short-term recognition, decreased filtering of unnecessary stimuli, and there's a high density of CB1 receptors in the hippocampus, which is very important for learning and memory. So in the mice that were exposed to THC as adolescents, they had a decrease in the number of neurons in their hippocampus and a decrease of synaptic density. Teens using marijuana for the first time after the age of 18 or never using it, compared to those using by the age of 15, are 3.6 times more likely to get a high school degree, 2.3 times more likely to enroll in college, 3.7 times more likely to get a college degree. This was a study done by Ferguson, who is in New Zealand and has a very large study of about over 6,000 children followed from almost birth into their young 20s. And they've collected a lot of variables, and in these analyses controlled for a lot of different possible confounding variables. So that same researcher, Ferguson et al., estimated that if you could have all teenagers not use marijuana by their 18th birthday, okay, then you would decrease high school non-completion by 17%, decrease university non-attendance by 5%, and decrease not getting a college degree by 3% is what they estimated. Adolescent marijuana use is a risk factor for fatal accidents. We know from laboratory studies that there's kind of this myth that marijuana is not so, it doesn't really impair driving very much. We know that of people presenting for substance treatment for marijuana, about 86% of them report driving while intoxicated with marijuana in the last year. So it seems like it's a pretty common thing to do. And we know from laboratory studies where people are intoxicated with marijuana and they're on kind of a video screen trying to drive, we know it impairs a lot of their ability to drive. Adolescent marijuana use predicts aggression. So in everything I've done, how I've been involved in this, somebody came up to me, a state senator came up to me and said, Thurstone, you've obviously never smoked marijuana before, because marijuana doesn't make people aggressive. It makes them passive and makes them very peaceful. And and I referred her, well, okay, I'll be happy to send you the reference, you know, Hoken et al., 2004. And but anyway, it looks like the story here is that in a lab experiment in which they got young adults, brought them into a lab, got them intoxicated with low dose of marijuana, or low dose THC, 0.1 milligrams per kilogram, and gave them kind of a standardized assessment of aggression. It looks like the low dose marijuana increases aggression, high dose marijuana decreases aggression. And then this is an interesting experiment here where they got young adults who were heavy marijuana smokers over 5,000 times in their life, and made them be abstinent for up to 28 days. And they brought them into the lab on days 3, 7, and 28 and gave them this laboratory procedure measuring aggression. And so during the marijuana withdrawal days, they had increased aggression at day 3 and 7, but it was back to baseline by age 28 and didn't differ from controls at day 28 either. Adolescent marijuana use and HIV, STDs, and teen pregnancy. And this is kind of, I think, becoming a more important issue to me, because I think it's exactly, the people who get HIV are exactly the kind of people that child psychiatrists, child mental health providers see. It's people with young people with psychiatric and substance use disorders. So if you think about it, child psychiatrists, child mental health providers are really at the forefront of this HIV epidemic. And so adolescent marijuana use is clearly associated with an early onset of sexual intercourse. And in our own data here in Denver, teens with marijuana use disorders have a mean onset of sex by about 13 years. They have an increased number of lifetime partners. So at age 15.7, our patients have had an average of 6.2 lifetime sex partners. And 55% report using condoms sometimes or never, and 14% have had a sexually transmitted disease by that age. Then there was another study of 656 Denver teens who were on probation, and they were followed up at 12 months. So this is a nice prospective study here. And the baseline frequency of marijuana use predicted subsequent STD diagnosis at 12-month follow-up. And the number of depressive symptoms predicts non-condom use in the last 6 months as well. And then the marijuana advertising that targets adolescents. And I just wanted to give you some examples of that there. Clearly, it's very youth-oriented advertising. 70% of the patients on the medical marijuana registry are male. And so you can see who it's appealing to there. So what you have here is marketing to youth because you need to develop new users. So you